So my name is Anto Leis, and I'm the director of the Spanish Agency for International Development Cooperation. That's Spain's main development agency.
Wonderful. What has inspired you about the forum so far, the community so far?
I would say what is inspiring about this forum is three things. Number one is for putting a topic in an agenda that is absolutely important. We need to learn the lessons of the global pandemic. We need to tackle global challenges, and pneumonia is a global challenge, a major global challenge that is killing children, particularly in the global south. So as a development agency, as development workers, development people, we should be focusing on these topics and, as I said, learn the lessons of the pandemic. Number two is the positive, upbeat message that this can be fixed. We know it can be fixed. We know that it can be fixed rather quickly if we put the resources and the efforts, the political will in doing so. And number three is the idea of partnership. We have here in this global forum governments, the private sector, non-profits, excellent partners for us, such as UNICEF and the Bill and Melinda Gates Foundation. So creating this partnership and working all of us together in a coordinated manner, we can put an end to this. So that's, I think, the three messages that I take from this global forum. Together we can tackle this, and it's a realistic goal. There are many challenges in the world today. This is a major one. We should not lose momentum after the pandemic. We need to continue investing, and I underline the word investment because this is not an expenditure. We are all better off by putting money and resources into this in global health. And pneumonia is, of course, a challenge. We need to give every child in the world, every boy and girl, the opportunity of celebrating a 5th birthday.
Thank you. How is Spain fighting against childhood pneumonia?
Well, childhood pneumonia for Spain and for Spanish cooperation is a priority. It's a priority because it touches upon two topics that are at the heart of what we do. They are part of our DNA. On the one hand, children's rights. And that's a topic for us that is, of course, a sector of intervention. We work on children's rights all over the world, but it's also a cross-cutting theme in everything we do, from education to health. So we are promoting in collaboration with partners such as UNICEF, the Bill and Melinda Gates Foundation, the empowerment of children, the fulfillment of their actual human rights, whether it is the right to health, the right to education, the right to participation, and for their voices and their interests to be heard in policy making. And the second priority is, of course, global health. Spain has a few things to offer to the world, but one is, of course, its universal health system that is an effective and efficient system that we put together. We've been quite active in the fight against the pandemic. We are the 6th largest donors of vaccines in the world, the 2nd in Latin America. That is a region that is, of course, very important for us and that had the risk of being left out of global efforts in terms of vaccination. So we are working with partners. We are working on children and on all of their rights, of course, health, and of course, fighting pneumonia, fighting other types of diseases as well, particularly those affecting the global south. Yesterday only, the day before this forum, was World Malaria Day. So we are concerned with pneumonia, we are concerned with malaria as well. But I think one major lesson, I think that's perhaps what Spain does differently compared to other partners, is that we invest a lot in the systems, in the health systems. One of the lessons of this pandemic is that it is important to tackle specific diseases, and there's great work done prior to the pandemic. We need to catch up on pneumonia, on malaria, on tuberculosis, on AIDS, but we also need to invest in the systems because we know that the most inclusive, the most robust, the most sustainable health systems we have, the better health outcomes we have as well.